One of the most common repairs for cracks in foundation walls is to ultimately inject, or you do an epoxy injection on a crack. And the way injecting cracks or poly injections work is ultimately the crack has to be wide enough for one. Some people don't necessarily realize this, but the crack needs to be wide enough to accept the injection material. So at KC Pier, one of the first things we do is prepare the crack. And maybe I should even back up. What you're trying to accomplish when you inject a crack is you're trying to address an outside issue affordably without digging up from the outside, from the inside of the home. And that's what an injection does. So we're trying to penetrate the crack and get material to the outside of the home without digging up from the outside. So what we do at KC Pier is we tend to clean the crack. We want to create enough space in that crack to ensure that our injection material gets to the outside of the crack. And so ultimately, there is a clean out process. And once that crack is cleaned out, then it can be prepared for the injection. And by the way, we do have a really nice video that goes step by step on injections that I encourage anybody that looks us up. We have a channel on YouTube, our KC Pier channel. Look it up and look up epoxy injections. It's a great step-by-step manual. But you will then smear the crack, which seals it, and then have ports about every 12 to 15 inches that are going to be used to inject our epoxy injection material. So once that is dried, then we go into the ports and we inject the cracks themselves. The material tries to come out towards the inside, but the smear is in place, and so it's forced to go through the wall and ultimately try to adhere itself to the outside of that crack. We do that in a series, each port, until ultimately that material and the full crack has been exposed. Then at that point, we allow it to dry. Within 24 hours, we can come back, we can cut those ports off if you want as a homeowner. You can paint that injection material, but ultimately you have a crack that's been sealed, injected, and then has the appropriate warranty placed on it, depending on the type of crack, how wide it was, and the other variables that kind of go along with it. But it's a rather simple process. It does take a lot of time to do, but it's a rather simple process in terms of its step. You just have to have the right material and a little bit of knowledge and time and patience to ultimately ensure that you're injecting the crack and that the crack is injectable. I guess that's maybe the one thing we see with homeowners. And we see a lot of different materials trying to be injected in cracks, and sometimes we have to fix that because ultimately it doesn't work out. So it's always nice to have the right materials, the time, and the knowledge to do so. But ultimately, if you have the right materials and the time, you can fix a crack, and it may stay dry after it's been injected for years after that. And most all cracks can be injected. Obviously the ones in a poured foundation wall can be injected unless they're too skinny. They're just not thick enough or wide enough to allow. We don't encourage people to inject cracks in corners because you don't know the direction that crack is going. If you have a block and mortar wall that we see commonly throughout Kansas City and Missouri, and the houses that are built into the early 40s into the early 50s, those can be injected as well. Stone is a different animal. You can't really inject stone. There's just too many break points in those. So we have alternative solutions for stone walls, and we're one of the few companies that have multiple solutions for stone foundation walls. So we encourage people to call us, but injecting a crack on a stone wall is really simply not an option. Even with crawl spaces, it doesn't matter. Slabs potentially have solutions that might be related to injection, not too often, but maybe. So there's lots of options. So if you're seeing a crack in a wall, depending on the type of wall that you may have, what I encourage anybody is just to simply call us, take a few pictures, send us a quick text or an email. We can take a look at it and give you some advice from there.